Hi, my name is Dr. Craig Curtis. I'm the Chief Medical Officer at a large clinical trial facility and have been performing lumbar punctures for over 20 years. Lumbar punctures are incredibly safe. In the United States, we perform approximately 400,000 of these procedures each year with an incredibly low complication rate. The most common complication is a headache. However, adoption of atraumatic pencil-tip needles has reduced the headache rate from around 40% to as low as 5%. In addition, using needles with a significantly smaller diameter contributes to a lower complication rate, so we now commonly use 22-gauge needles as opposed to 18-gauge needles. Patients usually imagine we will use a huge garden hose-sized super sharp needle. I like to change this perception by demonstrating to patients how small the needle is by holding a 22-gauge needle a few feet away from them. They usually have to squint to see it, and this visual really helps them understand how small the needle actually is. And it goes a long way in reducing most of their fear and anxiety towards the lumbar puncture. However, a significant issue remains, as most physicians in the United States do not use atraumatic needles, with cost being the primary barrier. They are about 4 times more expensive than traditional needles. In fact, one study showed that by using atraumatic needles, you can actually lower the overall cost of the procedure, primarily due to a decrease in complications. Additionally, the use of traditional cutting needles goes against the American Academy of Neurology, which recommends the use of atraumatic needles for lumbar punctures. One study comparing atraumatic needles to traditional cutting needles using electron microscopy showed that atraumatic needles leave smaller holes that tend not to remain open and have 3 times less leakage than traditional cutting needles. Now let's talk about lumbar puncture versus amyloid PET scan. Many studies have shown, and most clinicians agree, that using either amyloid PET or lumbar puncture can similarly help in the diagnosis of Alzheimer's disease. Please keep in mind that neither procedure is 100% diagnostic for Alzheimer's disease. However, when using PET scans, there can be a number of challenges. There are only about 2,500 machines in the United States, which are already in very high demand for oncology patients. In fact, this situation may get significantly worse when future PET ligands for other indications, such as the detection of coronary artery disease, become approved. Also, while PET is an important diagnostic tool, the radioligands are expensive, hard to get, and present radiation exposure to patients. Also, commercial PET scans in Alzheimer's disease diagnosis at this point are limited to amyloid measurement. Other proteins that are thought to play a role in Alzheimer's disease pathology, such as tau, can only be visualized by experimental, non-validated PET tracers. It's for these reasons it's still important to pursue the collection of spinal fluid in patients suspected of having Alzheimer's disease. The collection of cerebrospinal fluid via lumbar puncture is a safe and simple diagnostic tool and can be used in the search for novel biomarkers.